Assalamu alaikum. Hello to everybody. My name is Dr. Zainab Abdullah and I am currently working as head of department medical education Bashir College of Dentistry. Well, it's interesting to talk about like this and submit your views. I would love to share my views physically too. Well, when I was asked about to talk about a social cause, I was just wondering one fine day sitting back at my terrace, early morning of winters, when I saw a young gang of teens passing by my street, looking into my eyes and vaping with no shame. Oh my god, I just wanted to start my presentation actually vaping and showing you how cool does it look. Vaping. Yes, it's a serious invisible threat to teen smiles. I actually want to talk about this today. Look at this beautiful young girl who had no idea what is she doing to her beautiful smile. With her peer pressure getting involved in vaping, led herself to multiple serious dental issues. Well, another case which I saw was a 22-year-old woman from Manchester was diagnosed with lung cancer after years of vaping and later had part of her lung removed. She now urges others to quit. But what's the point now? Today my agenda will be I will be talking about the vaping, how big the problem is, and what are the harmful effects of vaping, how it is affecting our oral health physically and neurologically. Plus, how can we prevent it? How can we do the screening? And how we can have the cessation strategies? And how, as a dentist, we can play a role in this. Vaping is increasingly present among the teenagers and young adults due to easy availability, attractive flavors, and social media influence. Many people mistakenly believe it is harmless or safer than smoking. This growing presence has become a serious public health concern worldwide. It contains nicotine, which is highly addictive and can damage the developing brain, especially in teenagers. The chemicals in e-cigarettes vapor can irritate the lungs, causing breathing problems and increase the risk of lung disease. Vaping also affects the oral health by causing the dry mouth, gum disease, tooth decay, and bad breath. Vaping can cause xerostomia by reducing the saliva production due to harmful effects of nicotine. Saliva is important for protecting teeth and gums, so its reduction increases the risk for tooth decay. Dry mouth from vaping can also lead to bad breath and oral discomfort. Over time, xerostomia may contribute to gum disease and oral infections. Vape-related enamel demineralization occurs because e-cigarettes aerosols contains acids, nicotine, flavoring agents that weaken tooth enamel. Nicotine reduces saliva flow, decreasing the mouth's natural ability to neutralize the acids and repair the enamel. Sweet and acidic vape flavors increase the plaque formation and promote mineral loss from enamel. Over time, this demineralization makes teeth more sensitive and more prone to cavities. Nicotine can contribute to temporomandibular joint dysfunction by increasing the muscle tension and reducing the blood flow to the joint area. This leads to inflammation, pain, and limited jaw movement. Additionally, nicotine's effect on the nervous system may heighten sensitivity to pain, worsening the TMJ symptoms. Therefore, nicotine use, including through vaping, can negatively impact the TMJ health. Quit. Just quit. It doesn't work for teens. What does it mean? Because nicotine addiction affects the developing brain, making craving stronger and self control harder. वो कहते हैं ना कि मंजिलें पाएंगे जब हम नशा छोड़ देंगे, जिंदगी की कदर करेंगे, खुद को संवार लेंगे. ये कहना तो आसान है, वो करना मुश्किल. नशा छोड़ दो, ये राह फना की है, ये लम्हे कीमती हैं, जिंदगी की दुआ की है. In order to prevent or actually control this thing, we should include simple questions in history forms. Like, do you vape or use e cigarettes? Use calm language to encourage honesty, no lecturing. We should look for the clinical signs, dry mouth, inflamed gums, educate short term effects they care about, bad breaths, stains, use visuals or quick comparisons. वो कहते हैं ना, नशे की गिरफ्त से बचो जवान, ये लम्हे गवा देते हैं अरमान. So we need to make them sure that you're losing something very big. We should use the motivational interviewing, provide quit resources app. Actually, this is, a social media world, so we should just let them know there are apps which can help them actually quit vaping. One other way is actively screening and educate the patients about the vaping's dangers to protect their oral and overall health. Advocate for stronger public policies to limit the youth access to e-cigarettes. Collaborate with schools, communities to raise awareness. Together we can reduce the vaping impact and promote the healthier futures. So this is one very important way, that we go to schools and create awareness among the students, and also among the peers we should have the visuals to make them see what are the harmful effects. Actually, we as a dental professionals, we hold the power to protect the next generation from the harms of vaping. We can start by screening every patient, especially teens, for vaping habits, and educate them about the serious risk it poses to oral and overall health. Speak openly with the parents and communities, and advocates for stronger policies to reduce youth to access to e-cigarettes. Together, let's commit to stopping vaping before it damages more lives, because prevention starts with us. I thank you now. These are the few references which I've taken this presentation. There is a very short feedback form. It will take hardly 2 minutes. Please kindly fill this up for me so we can have a data record. And thank you very much. It was a pleasure talking to you all.